Humans are social creatures, but to stop the spread of COVID-19, the novel coronavirus, we all need to do exactly what we're biologically programmed not to do: social distancing. We humans don't have big claws, sharp teeth, or hard shells. We've evolved to feel safe by sticking together. Therefore, few things are more alarming to our systems than suddenly being alone. Just like how, when we're deprived of food, we feel hungry, when we're deprived of social connections, we feel lonely. Loneliness, like hunger, is a warning signal, reminding us that we're not meant to be alone and encouraging us to form deeper connections. If we can't form deep social connections because, say, we're social distancing due to a global pandemic, our bodies go into survival mode. We start producing more cortisol, a stress hormone that keeps us alert to threats. Our bodies experience more overall inflammation, a way to prepare to heal any injuries we might get while out on our own without help. And our sleep becomes shallower, so we can wake up to dangers in the night. These survival responses help us get through short, threatening bursts of isolation. But the longer we're lonely, the more these changes wear on our cells and organs. That's why perpetually lonely people are at higher risk for mental, physical, and emotional problems and have weakened immune systems. So, we're stuck inside for the foreseeable future, and this creates its own unique problems.
Okay. So, as you have gathered from our video, our first speaker will be talking about the effects of social isolation on adolescents and the mediating effects of digital media. Let's all welcome Dr. Abigail Cardinal. Good evening, Dr.
Hi, thanks, Anit, and thank you for that introduction. I feel happy that finally we are going to talk about other issues that our adolescent might be facing right now. So actually, there are about 30 million young people in the Philippines, which account for about 28% of our population. That's why it is very important that we know how to support them. So, but before we start, let me present to you my objectives. To describe developmental changes in adolescents, to explain the mental health effects of social isolation to adolescents, to explain and enumerate strategies to mediate effect of social isolation, and to identify roles of digital media on social isolation. So I got this from the WHO website, data taken from the DOH as of July 2020. It says that about 7% of children and adolescents got infected with COVID. So they are less likely to get the disease. It's a small but significant number, and we cannot just neglect them, right? And it doesn't account those adolescents being monitored in an isolation facility and at home. But regardless whether they are admitted at home or in a hospital, being isolated at home, they might get the same effect of social isolation. So for some adolescents who are not directly affected by COVID, the greatest impact of COVID to them stem from school closures. School closures provide structures and routine to the lives of many students, following from the routine getting up at a certain time, going to classes at a specific time, and coming home at a certain time provides a sense of normalcy in their lives. So many friendships actually started by just sitting beside your new classmate, right? Remember when you were in high school? So the highlights of a student's day might be just walking down a hallway or canteen during break time, because that's when you can reliably expect to see your crushes. While in school, young people are also exposed to a variety of different culture and ways of living that may be different from their own. So through interaction with different personality, the social skills of adolescents develop. So school closures will lead to disruption of structures and daily routine. Teen missing out important milestones like graduation. So remember how long they've waited for their graduation, and then it may be frustrating for them to cancel the event. It may be similar small things for us, but it means the world to them. Another is them missing their extracurricular activities, where most of the skills usually starts to develop. And most importantly, missing out the social interaction with their friends. So As we go along, we will highlight how social isolation in adolescents might have far-reaching consequences. So reducing adolescents' opportunity to engage in face-to-face social contact outside their household might have these effects. So they may have anxiety, stress, depression, and social isolation.
So, Doctora, can you explain further on why social connection is so important to our teenagers?
Okay, Anita. So before I answer that, let me define first adolescents. So they are the age group 10 to 19 based on the World Health Organization. It is further subdivided into three. So we have the early, the middle, and the late adolescents. It is characterized by changes not only in physical, but also in psychosocial and cognitive development. So, however, most of us associate adolescent period as a negative kasi minsan we just associate it to heightened sensitivity to peer pressure, di ba? We often hear the mother saying, nabarkada yan, so parang negative agad. When actually, interacting with their peers have a lot of impact to their development. So why do social connection with peers so important? Because it is important for their psychosocial and cognitive development. So adolescents undergo different stages in psychosocial development. I'm sure all of us can relate to this, no? So, but the changes doesn't happen at the same time in different individuals. So, but regardless of the timeline, the prevailing theme for this psychosocial development involves an initial body image at early adolescence, and then it happens as a result of rapid changes in their body. And when they become more comfortable with their body, their concern naman shift to acceptance of their peers in middle adolescence. So later on, we will explain why peers are an important part of their identity searching. By the way, searching their identity is actually the ultimate task of adolescents. And as they do this, they tend to move away from the shadow of their parents and they seek independence. So the influence of the parents will become less and less compared to their peers during this time. And we call this social reorientation. So this social reorientation is important because it enables them to foster a more complete sense of identity. And at the same time, it helps them build a stronger connection with their peer group.
Okay, so Doctora, can you explain the biologic basis why adolescents seems to be really attracted to their peers?
Yes, I need not. So to answer your question, let me go back in their brain development. So for many years, the stormy behavior of adolescents was blamed on hormones alone. However, in 1990, there were a group of researchers in National Institute of Mental Health in the US who scanned the same 13 healthy children and teens every 2 years as they grew up to 15 years. And the result was really significant, especially on our understanding of adolescents, cognition, and behavior. So the result of their findings for 15 years was compressed in these time-lapse videos. And they found out that the adolescent brain is still developing. So the brain is not yet fully developed until mid-20s. So both structural and functional brain development continue throughout adolescence. So the main changes involve a decrease in white matter as a result of gray matter as a result of synaptic pruning or cutting off unused connection, and an increase in white matter as a result of myelination. So the overall result of these changes is a better organized brain and efficient transmission of information between different regions of the brain. However, the part of the adolescent brain which mature first are those structured at the back. So those are the ones that control physical coordination, vision, emotion, while the regions of the brain associated with executive function have been considered to be among the last to mature. It's the very reason why teens have a difficulty in holding back or controlling emotions. They have poor planning and judgment, and they have preference for high excitement and low effort activities like video games and drugs. So these concepts can also assist us in understanding the risk-taking behavior of adolescents. In some literature, adolescent brain was compared to a car with full acceleration but full acceleration but poor brakes. Okay, so another important concept to know is that the prefrontal cortex, the one responsible for executive function, is also the one responsible for social thinking, like in mentalization, which is the ability to understand others, empathy. Unfortunately, they require higher cognition function. And they are to develop during adolescence through interaction among peers, which we earlier established has the greatest influence to adolescents during this time. However, the characteristic behaviors of adolescents, such as risk-taking and peer orientation, are very important to their successful transition into a stable adult role. And they are a reflection of our brain development. So it shouldn't be viewed as something negative, but rather an opportunity for learning new skills and identity. Again, adolescents need the peers for social cognitive development because two of the developmental tasks needed for successful adult transition are to develop during this stage. No? So the social skills and empathy and a sense of identity. So both of these tasks happen through interaction with peers.
So we can say that social interaction is really important for our teenagers. Is this why adolescents also appear to be vulnerable to peer pressure?
Yes, and also, there's a neurologic explanation for that. And however, the behavioral correlates of adolescent neurodevelopment remain to be speculative, but they are increasingly supported by many researchers. So adolescents appear to be more sensitive to the effect of dopamine in the brain reward system compared to adults or younger children, and that they are very responsive to peer-related social reward, such that the mere presence of peers increases their risk-taking. And when compared with adult counterpart, they exhibited higher risk-taking when they are with their peers.
Again, Doctora, you have emphasized social interaction is very important for their development. Now, knowing this, what are the effects of social isolation to our adolescents?
So the consequence of deprivation of social needs during adolescence resembles the features of human neuropsychiatric disorders like depression, anxiety, due to lack of experience for social learning. So specifically, I'd mentioned earlier, increased anxiety-like behaviors, depression-seeking behaviors, reward-seeking, aggression, and self-harm. In another study, it showed that depression were 3 times more likely to develop among young people due to social isolation, and the effect may last up to 9 years. For those patients naman being monitored in quarantine facility and also in the hospital due to COVID, they noted the same effect as a result of social isolation at home. They are also prone to anxiety, acute stress, and they have 4 times risk to have PTSD or post-traumatic stress disorder as a result of stigmatization and fear of the unknown.
Oh, okay. So that's very concerning. So what can we do to help our patients or their relatives who are facing social isolation?
So first we have to talk to them. So ask them for what they think and what they feel. Tell them that if they are sad or they are lonely or they fear something, tell them that what they are feeling is perfectly normal. It helps kasi to normalize their feelings. We should also ask for their understanding of their illness. Sometimes it is not really the stress that is distressing, but the incorrect perception of the illness. It may lead to bad feelings, so asking about it may correct the wrong perception and the incorrect feeling associated with it. We should also explain why they need to stay at home or inside the hospital. Understanding will vary depending on their developmental stage because yung mga early adolescent, actually to middle adolescents, are still concrete thinker, meaning it would be difficult for them to understand things that they can't see. Like COVID, it also might be difficult for them to understand the consequences of certain action. While late adolescents have developed the abstract thinking already, and however they may regress developmentally during stressful situation like illness. So better for me is to assume na lang that they don't know, and teach all of them. If you need pictures, you may do so para they will understand better. For our patient naman in quarantine facilities or in the hospital, it is very important to do a psychosocial screening. So it's quite long, but you may do a focus screening. You may do the focus heads, since we don't want din naman to compensate your safety, since most of your patient will come to you asymptomatic, right? So we identify the issues and prioritize what do we need to focus first. You can always ask them naman to follow up for a comprehensive psychosocial screening, which we usually do to our adolescent when the situation gets better. Also, focus on the techniques. You may have memorized all sort of questions you have in your heads 3.0, but if you're not practicing confidentiality, you are being judgmental, or you don't know how to properly ask the right question, you might not get the details that you want to elicit. The adolescent might not open up to you. And also beware of, important ito yung mga non-verbals natin, no? Like yung rolling of the eyes or yung pagbunting hininga natin. No? It may send a negative signal to your patient. So the least that we can do is to actively listen. Sometimes naman, they are not actually asking for your advice. They just want to vent out their feelings, their fear, and their frustration. Just so you know, there's already a modified PHQ-9 for adolescent, and that it takes into account the symptoms commonly seen among depressed adolescent, like irritability and school problem. There are actually many phases of depression in children. Hindi lahat ng may depression malungkot. And sometimes they can't label their feelings. So it helps to do this screening. The screening also takes into account duration of illness to differentiate the major depressive disorder and yung PDD or persistent depressive disorder. So here's the scoring and the interpretation. I will just run through this because we have another lecture on depression and suicide after 2 weeks. Also, if your patient verbalizes thoughts of suicide, or you notice them having suicidal behavior like slashing of wrists or banging their head on the wall, there's a suicide rating scale for that to check the severity. So if it's just a suicidal ideation, it is low risk. If it's a suicidal method, meaning naisip nila kung paano nila gagawin, it's moderate risk. If it's suicidal plan, meaning naisip nila, alam nila kung paano gagawin at may plano sila kung paano gawin, it is high risk. So to guide you on what to do, here's the recommendation from the PPS Mental Health Task Force. So if your PHQ-9 score is 11 or more, you do the CSSRS. If less than 11 naman, but your score is either 1, 2, or 3 on number 9 in your PHQ-9, which is the suicide question, you proceed also with the CSSRS. Then, you stratify the risk as to low, moderate, or high risk. High risk means same-day psychiatric or referral or hospital admission to a mental health facility. At our level, as a pediatrician, at least we can do a psychoeducation, basic counseling, and safety planning. But we may also start psychiatric meds if warranted. Then we also have a screening tool for anxiety. Anxiety is the most common mental health issues among adolescents, not depression actually. Sila yung dumarating sa clinic na or sa ER na nagpa-panic attack or sumasakit ko yung mga iba-ibang parte ng katawan despite all your medication. So if you ruled out all the possible causes, all the organic causes based on the symptoms, you may do the screening tool. So the screening tool, yan yung Scared and God7, the shorter version. And all of these are downloadable online. We also need to manage their mental health if we identified one. So as a pediatrician, we must educate the patient and the caregivers on the nature of their illness. So we do the psychoeducation. Also, we should do a basic counseling. No? If they are scared or anxious, again, we should validate their feelings. Tell them that what they are going through is just normal. And also it helps if we reframe some of their beliefs, like if they told you that they are sad because they are stuck in their house, you may reframe it by saying, maybe you are safer at home. Again, sometimes they just want someone to listen on their feelings or their frustration. If you screen the patient having moderate to severe depression, you may start the patient on antidepressant. So we have the SSRI or selective serotonin reuptake inhibitor. The SSRI is also effective for, the low dose of that is also effective for moderate to severe anxiety. So we usually start escitalopram and fluoxetine for adolescents. But be careful on your SSRI because there's a black box warning saying it may increase with suicidal thought. So if you start the patient with medication, you should monitor the patient closely, like weekly for the first 4 weeks. And if they have pre-existing psychiatric condition, you may refer the patient to a child psychiatrist. Again, we don't want to put your safety at risk. So if it's not high risk, you may do an online video conferencing or counseling like what other institutions are already doing. Also, we can help our patient to develop a regular routine at the hospital or at home. This provides distraction and also reduces their stress. We also need to provide them alternative ways to connect with friends. So we can always go back naman to the old ways like writing a letter or asking them to call their friends. But we can also explore other digital sources of connection like social media, video chatting, conferencing, and blogging.
Okay. So, Doctora, you have mentioned digital forms of media. So, how does digital media help in mediating effects of social isolation?
Okay, recently, the director of Johns Hopkins released a statement. So he said adolescents depend on their mobile devices to connect with their friends. And it's more important for parents to help them use screen time in a good way rather than simply limiting its use. So he further said that trying to maintain the same screen time rules as pre-pandemic is just going to increase the stress between the adolescent and the parents. So we have to make some changes in terms of what we find acceptable. That was according to Johns Hopkins. And he said that the type of screen time is more important than the amount of screen time. So there are two types of digital media usage. The active social media usage refers to online behaviors that facilitate the direct exchange among users, such behavior include liking, commenting, sending message, and otherwise engaging with other users. In contrast naman, passive use include monitoring lang other people without directly engaging or messaging. So they found out that active social media use was related to decreased symptoms of anxiety and depression, while yung passive use was related to greater symptoms. Other benefit of social media, according to the teens, is that it makes them feel more connected to what's going on with their friends and make them feel as if they have people who will support them through tough times. So the core component and qualities of adolescent face-to-face interaction, including information, disclosure, interactivity, social reward, and social support, are also present when communicating online. Then another study also mentioned that identity development, which is one of the developmental tasks, can be attained through social media. Apparently, there was also evidence on human brain. So it said that functional imaging results show that positive online chat evoke reward activity in the brain similar to other face-to-face reward. However, again, there are disadvantages of digital media use, especially if the adolescents are not guided on their usage. Apparently, they can also lead to depression and social anxiety. So the recommendation, this is based on a study in AAP, is that for our clinicians to make the parents and the teens aware of the positive and negative outcome of social media use. As to the length of media use, the recommendation before COVID kasi for teens is guided screen time. However, it shouldn't be disrupting their sleep, daily activity, and in their learning in school. So other internet safety procedure will be discussed by our next speaker, Dr. Maanyong. So here's the summary of my lecture, and thank you for listening.
Thank you, Dr. Abigail. So I hope that our viewers were able to focus on the summary of the talk, since I think most of you were focusing on the song and singing along with the Friends song. Anyway, thank you, Doctora, for emphasizing that we should be actively listening to our teenagers, and that social isolation really has an effect, since social interaction is very important for their development. So you are not yet done, because we will be having some games. Okay. So we'll be inviting everyone to join us in this game. Okay. If you really listen to the lecture. Okay, so this is called Movie Night. We will be presenting some short clips and then asking you some questions that you would have to answer. So Dr. Abe, can we start with the first one? Are you ready?
Yeah.
Okay, so this is our first clip. Okay, so, we can identify with the child. So, but the question is, identify the teen's developmental stage. Is it A, early adolescence, B, middle adolescence, C, late adolescence, or D, emerging adult? So, there will be a poll. So, okay, we're just waiting. Sorry. Okay, so I guess we're not able to appreciate the clip because of some difficulty. Okay, so let's try that once again. So can everybody already see it? Okay. So let's start with the first clip.
Jenna Rink couldn't grow up fast enough.
Smile, sweetie.
Don't you knock?
Are you wearing a bra?
You're not ready
Dad,
for
stop
a bra.
So
Okay, so the question is, okay, let's identify the teenager in the clip. So identify the teen's developmental stage. Is it A, early adolescence, B, middle adolescence, C, late adolescence, or D, emerging adult? Please type in the poll, and it will be in 5, 4, 3, 2, 1. So let's show the results of our poll. Okay, most of you, 61% answered early adolescence. Dr. Ave?
Yeah, the answer is early adolescence. Very good job. As you can see, the patient is really conscious with, I mean, the actress is really conscious with her appearance. He looks so much aware that her breast is not yet developed. So yeah, an early adolescent.
Well, natatoxic siya do sa parents niya rin.
Mm.
Okay, so this is our second clip. So good job, viewers. So our second clip is this one. Please focus on the girl. Okay, so the teenager, the girl, please identify the teen's developmental stage. Is it A, early adolescence, B, middle adolescence, C, late adolescence, or D, an emerging adult? Okay, please type in your answer. Okay, in 5, 4, 3, 2, and 1. So our poll says, yung answers ng ating mga viewers. So 48, nako, hati sila, halos. Pero highest pa rin is middle adolescence. Dr. Abigail?
Yeah, the answer is letter B because the peak of risk-taking is really at the middle adolescence.
Okay. Buti naka-focus yung ating viewers. I just focus on the, stop focusing after they showed the face of Captain America. Buti pa sila. Okay. Anyway, our third clip, please focus again. I think most of you know this movie, so please focus on the girl who will be going down the stairs.
Lainey! Cute butt down here! Swing, swing, swing the spinning step. You wear those shoes and I will wear that dress. Oh, kiss me.
Okay, so Lainey Boggs, please identify her teen developmental task. We're talking about the task. Is it A, body image issue, B, social relationship, C, risk-taking behavior, or D, independence-dependent struggle? Time in now. And it's in 5, 4, 3, 2, 1. What's your answer? And our poll says it's social relationship. Dr. Ave?
Yeah, that's right. Usually during middle adolescent, usually the relationship is about towards peers. Eventually, at the late adolescent, it became one-on-one. So, social relationship.
Okay, so far so good. Our viewers are really into this. Ako, nag-focus lang ako kay Freddie Prinze saka sa song. Okay, number 4. So, most of you know this movie. Otherwise, you're hiding under the rock.
Primrose Everdeen. Where are you, dear? Come on up. Well, come on up.
Okay, so identify Katniss Everdeen's developmental stage. Is it A, early adolescence, B, middle adolescence, C, late adolescence, or D, emerging adult? Okay, poll starts now. And it's in 5,
Katniss is the older girl.
4, 3, 2, 1. Okay, and the result. Okay, she is an emerging adult. Dr. Ave, 58%.
Yeah, actually pwede namang emerging adult. Usually the late adolescents already have developed that prefrontal cortex based on our lecture, no? So pwedeng late adolescents and emerging adult.
Okay, so pwede pa rin yung answer nila, Dr.
Yan, tama pa rin.
Yes. Okay, and last, okay, sorry. So this is our clip.
How many times have I told you I'm not going to Princeton?
Listen, I'm not pressuring you, son. All I'm saying is give it 4 years. If you don't like it, there's always a job waiting for you at my firm.
I don't want your life.
Okay, so we're talking about the teenager here, Chris Evans. Identify the teen's developmental task. Is it A, finding self-identity, B, social relationship, C, moving to independence, or D, A and C? Sorry, that's D, A and C. Please type in your answer now. So 4, 3, 2, 1, and the results show, okay, 90% is letter D, finding self-identity and moving to independence.
Yeah, that's the right question. I'm sorry, letter D. Because the actor seemed to be pissed off when he saw the father inside the room. So, ayan, moving to independence. And then he said, I don't want your life. So, he wants to establish his own identity. That's why A and C.
Okay, thank you so much. Okay, Dr. Abigail, thank you so much for navigating us through the difficulties that our teenagers are experiencing now during this pandemic, social isolation, and the effects and the mediating effects of digital media to them.